untreated heartburn or acid reflux can lead to cancer, which is pretty crazy. If you want a way to force your body to permanently stop acid reflux and heartburn in 48 hours, click the link in the description below. For now, let's get to today's question.
The question: when you constantly have heartburn and acid reflux, what is that a sign of? Answer by Jacob Teitelbaum. Indigestion is not caused by too much stomach acid. Rather, it is caused by poor digestion. When the food does not digest and sits in the stomach for too long, your stomach starts to hit the return to sender button, and you get acid reflux and indigestion pain. Chronic acid blocker medications have been shown to be very toxic. These are best used for short term, with Zantac or Tagamet being preferred if they are needed for longer use. They also allow one to wean off of the stronger acid blockers, which have been shown to be very addictive, causing rebound acid hypersecretion when stopped. The best approach is to improve digestion. This can be done with plant-based digestive enzymes, DGL licorice, and a host of other treatments that improve digestive function. Detailed information on this can be found on the free phone app Cures AC, with separate sections for indigestion and nighttime reflux. Treating the nighttime reflux is critical to allow the food pipe to heal so that daytime indigestion can also resolve. Answer by John Rutenberg. Occasional, intermittent or even daily heartburn is one of the most common complaints in our country as people get older or gain weight. Constant heartburn, on the other hand, suggests a complication or aggravation to the conditions that cause or aggravate reflux of gastric contents into your esophagus. For example, if you have started taking tetracycline or anti-inflammatory drugs at bedtime, the drugs may inflame, erode or ulcerate the mucosa or lining of the lower esophagus and make occasional heartburn much worse. Occasional reflux is normal. The barrier to reflux is a small circular muscle in the lower esophagus, 12 centimeters above the anatomic juncture of the esophagus and stomach. It is called the lower esophageal sphincter or LESP. It is not presently known why this sphincter gives out as we age, but it is responsible for a great deal of discomfort in our general population and supports a multi-billion-dollar antacid industry. When general measures such as elevating the head of your bed, weight loss, avoiding eating 2 hours before sleep, and occasional antacids don't work, it is time to review your symptoms with a gastroenterologist. He or she may decide to look at your esophagus and stomach on the inside, endoscopy, to determine the extent of the condition and make sure nothing else is going on and aggravating the problem, such as large hiatal hernias, peritone, L obstruction to the gastric outlet, gastritis, H. pylori disease, and cancer. It also gives him/her the opportunity to exclude a pre-malignant condition in the esophagus called Barrett's esophagus, which requires follow-up regular examinations and biopsies. Although powerful antacids are available over the counter now, you should not use them for more than 46 weeks because they may cover up serious conditions and delay their diagnosis. Answer by Franklin C. Nickel. Well, you should ask yourself a few questions re the cause of the heartburn. Specifically, 1. Have you been eating large meals or lying down right after a meal? Oftentimes, recurrent heartburn can be something more than just that. It could be a manifestation of a hiatal hernia, which occurs when part of the esophagus folds onto itself and protrudes into the chest cavity. Are you overweight or obese? This could also be contributing. Do you find yourself snacking just prior to falling asleep at night? Additionally, if you are an individual that consumes heavy amounts of alcohol, caffeinated or carbonated beverages, you may want to significantly reduce your intake. Lastly, most people often discredit the harmful effects of smoking, which may also be a contributory factor. If you have been on an NSAID for pain, i.e., ibuprofen, aspirin, vape, Motrin, during months, years, you may have what we refer to as peptic ulcer disease and should see a doctor soon. Unfortunately, what you may be interpreting as simple heartburn may also be early warning signs of a heart attack. Regardless, I strongly suggest you follow up with either A, your family physician, or B, an urgent care center.